Story now where the South African Human Rights Commission, or the SAHRC, has expressed concern at reports that some healthcare facilities are denying treatment to individuals on the basis of nationality or documentation status. The Commission says it is illegal and unethical to prevent undocumented foreign nationals from accessing medical healthcare facilities. We now speak to South African Human Rights Commissioner Sandra Makoasha. Sandra, thank you for joining us. How are you this Thursday morning?
I'm well, and yourself. Thank you for inviting the Commission.
Our pleasure. What triggered your concerns on this issue as the SAHRC?
What triggered the Human Rights Commission into issuing out the statement is the ongoing media coverage of persons being denied access to healthcare by civic society and the medical practitioners that are working there, but also the fact that we have received several complaints from those who have been denied access to healthcare.
The Constitution guarantees the right to access healthcare, but does that right also mean the right to receive free of charge this healthcare? Because that is the biggest contention, that non-South Africans pay for services.
And in terms of, I may be corrected, but the law specifically says, in terms of Section 27, everyone has the right to access to healthcare service, including reproductive rights, and then expands on that. And there's certain services that those who use it are then entitled to pay, whether you're a South African or non-South African. So there is provision for the payment of those services, and as the Commission, we are unable to speculate whether non-nationals are not paying for those services. It would be unfair to do so.
When we say that all people in South Africa, regardless of nationality, are entitled to basic health care, who is included on the list?
This includes refugees, asylum seekers, documented and undocumented migrants, stateless persons, children who are separated and unaccompanied, stateless children, persons in detention, and vulnerable persons such as persons with disabilities, older persons, and persons living in poverty. So you can imagine that is a vast number of South Africans and those living in the South African borders.
Yeah. Let's look at, besides the country's constitution, but what are South Africa's obligations on both the regional and international human rights laws?
So we've signed it's the Constitution, it's the National Health Act, but there's several treaties that we have signed in terms of the universal access to healthcare, in terms of the region, but also internationally. So we have treaties that obligate South Africa to provide emergency healthcare services, but also access to healthcare to certain people.
When one looks at the state of our healthcare system currently, it faces significant challenges, including underfunding, staff shortages, and inadequate infrastructure. It's overburdened. And some say it's due to the provision of services to non-South Africans. How would you answer to this?
It's incorrect to blame the systematic challenges on a specific vulnerable group, instead of saying these systematic challenges stem from a lack of adequate budget allocated to the Department of Health, therefore resulting in these systematic challenges you've mentioned.
You face criticism as a commission from some about serving interests of non-South Africans, while many South Africans are dealing with adverse challenges relating to poverty and lack of access to basic services. How would you clarify your role as the SAHRC to remove any misunderstandings?
The role of the Human Rights Commission stems from the constitutional mandate that we were given. So we will adhere to that mandate without fear or prejudice. But to add on to that, we have done so much in terms of poverty alleviation for South Africans. And most of the time when we get public scrutiny and focus, it's simply because we are dealing with controversial issues, which then allow people to then say, look at what the Commission is doing. They're not focusing on issues of South Africans, but we are on a daily basis. But however, we still have, as a Chapter 9 institution, you'll note that we have budgetary constraints, which then limit where we can be and how visible we want to be. But we are, as the Commission, working to ensure that in terms of human rights violations, we are at the center of it and reminding South Africans of our constitutional mandate.
As a commission, how will you continue with your monitoring work when it comes to this specific topic, and what are your plans in terms of engaging healthcare facilities, the relevant stakeholders within the space, like MECs, government officials, and the likes?
For example, in the last week of June, I was in Limpopo doing a monitoring. I met with the MEC of health regarding the Tsilizeni Hospital, which I stated I gave it a 4 out of 10 in terms of the observance of human rights. But in terms of what we're doing nationally, we are monitoring hospitals. We are then writing letters to MECs asking them for action plans. We are engaging with the Minister of Health when it comes to issues that are very important. But we've noted that in terms of how to deal with the systematic issues, it is one, progressive realization. It is also noting that the importance of the National Health Insurance Act, which may then alleviate these systematic issues that we're raising.
How do you encourage then the undocumented foreign nationals who have fallen victim to being denied health access in different cases, and those who might in future not know what their rights are, in terms of where do they go for assistance?
Should anyone be denied access to healthcare, they may lay a complaint at the Human Rights Commission's offices, but also then call upon the respective lay a complaint with the health ombuds to ensure that they be provided with the necessary support.
Further engagements moving forward, what is the Commission looking to do to tackle this issue?
In terms of tackling the specific issue, we are waiting for the judgment in terms of the Kopanang Africa, apologies. We made oral submissions there. We are waiting for that judgment. But we also want to remind South Africans to respect the rule of law, to call the Department of Home Affairs where necessary, to call the South African Police Service where necessary, so they can do the work and not take the law upon themselves.
Right. Let's leave it there for now. Thanks, Sandra, for your time.
Thank you.
Sandra Makoasha is South African Human Rights Commissioner, talking about a report that they've recently looked into, or concerns they've raised as far as reports that some healthcare facilities are denying treatment to individuals on the basis of nationality or documentation status.
Annika Longi sur Channel Africa.
Nous allons à présent dérouler notre tapis rouge pour accueillir notre personnalité du jour, l'artiste chanteur Heever, qui est en ligne de Guinée avec nous.
Je suis un artiste guinéen, un créateur, un styliste, et je fais un peu ce qui plaît à mes fans. Voilà, c'est un peu ça. On a beaucoup de genres de trucs à faire, mais bon, pour le moment, on est basé un peu sur le rap.
D'accord. À quelle période de votre vie avez-vous commencé à vous intéresser à la musique, Sheki?
Bon, je ne crois pas qu'il y ait une période, parce que moi, je suis un mélomane depuis mon petit âge.
Annika Longi, tous les dimanches sur Mix Vibration.
Zochitika ndimodapiri kamlondola wazochitika pena paliponse.
Nduna wazamalonda kumalawi waletsa kampani yopanga shuga ya Irovo yomwe ndi nthambi ya Irovo Sugar Group Limited kuti isiye kutumiza shuga kumaiko akunja. Malingana ndi nduna ya zamalonda Vitumbuko Mumba, izi zithandiza kuti shuga yemwe yakusowa pamsika azipezeka. Ndiye pano ndili ndi George Muhangu amene ali mu mzinda wa Blantyre mu dziko la Malawi. Chimene chikupangitsa kuti shuga azisowa ndi chani?
Chomwe chikupangitsa kuti shuga azisowa ndichonena kuti panopo ili ngati off season ya makampani a Irovo Sugar Malawi, kunena kuti sakutha kupanga shugayi okwanira chifukwa akukolola. Ndiye akamaliza kukolola pameneno atayambeno sopano kugaya shugayi kuti azipezeka. Chinanso ndichonena kuti ma distributors amene akumakagula shuga kaya ndi ku Irovo kaya ndi kusalima shuga akumagulisa kumaiko akunja ngati Zambia, Zimbabwe, Tanzania, Mozambique.
Zochitika ndimodapiri lolemba mpaka lachisanu pa nthawi ya 7 koloko kufikira 8 koloko madzulo pa Channel Africa.
From Cape to Cairo, Dakar to Dar es Salaam, rise and shine with Peter Ndoro and Asanda Beda on Channel Africa. Wake up to the essence of the continent. Rise and shine on Channel Africa.
Continuing with that topic, we discuss it further and speak to Professor Alex Fandenha, who is chair in the field of Social Security Systems Administration and Management Studies. Professor Fandenha, thanks for making time for us on this Thursday morning. How are you?
Good morning. No, I'm fine.
The Human Rights Commission is worried that foreign nationals are being prevented from accessing healthcare in the country, in South Africa. What is your take on this concern and what the reports are saying, allegedly?
Well, I think that the reports, I've read through the statement and I agree with it fully. Firstly, there is the issue of what is stated in the Constitution. It makes no distinction between citizens and non-citizens. But it is important to ensure that that the public health system properly regulates how the public health system is reimbursed for foreign patients making use of the public sector. And I just want to make it very clear, I've been part of the discussions on health reform for 30 years, and this was raised 30 years ago. And the problem has been that national government has done absolutely nothing to establish a reimbursement mechanism for patients from the region making use of the South African public health system. And that is essentially what is required. You don't transfer the risk of the failure to do that to the patients at point of service. And having essentially a group of people who have no business regulating the behavior of people at public hospitals, going and stopping them from using these services, that is unethical and wrong. But it is a responsibility of government to make sure that the system isn't overburdened as a consequence, but managing that situation in a fair and reasonable manner. And that's where government has basically failed.
What does the law say about healthcare and undocumented foreign nationals in South Africa?
Well, the law doesn't prevent access because essentially there is no proper, there's no framework that prohibits them from using the public system. And the Constitution refers to essentially persons, anybody that is somebody in South Africa can't really be denied access to healthcare facilities. They have the same, there's sort of equal rights for everybody to access healthcare. But the issue is that you have to make sure that you run the service properly and responsibly without being discriminatory or unfair to people. So this is the problem, is now how do you do that? But what you don't do is have people standing in military uniforms outside hospitals and threatening them for using the public health system. First of all, you're not necessarily discriminating between people who should or shouldn't be using the service, and secondly, that there are actually more reasonable means of making sure that the system is not overburdened, and those reasonable means have not been used.
You say this is an issue that arose about 30 years ago. So when we're talking about the list of who are we referring to when we say that all people in South Africa, regardless of nationality, are entitled to basic healthcare, has that list changed and added more, or it's remained the same?
No, it's essentially remained the same. South Africa has the right to differentiate users on a fair and reasonable basis to make sure that the system is properly available to South African citizens and permanent residents, and non-permanent residents also with rights to be in South Africa. It does have that right to do so, but the way in which it differentiates between those particular people must be fair and reasonable, and that is a requirement on the Constitution. The problem is when I say 30 years, it means right in 1994, it was understood that South Africa is always going to face a risk of people coming and crossing the borders and using South African healthcare services, and there must be a mechanism for making sure that there is intergovernmental payment for that. So that is the arrangement that should have been implemented. Now that's 30 years on, absolutely nothing has been done. So what you do is we're part of SADC, we're part of regional agreements and treaties, we're part of a customs union, we pay into that customs union. Parts of that money should be offset for patients from the region using our services, and that is fair and reasonable. But you don't transfer that burden to the patients, the people who need healthcare at point of service. And it is entirely, there are so many reasonable ways of setting up that arrangement, but to have done nothing in 30 years is unacceptable. And then to blame people at point of service, people are going to try and, it's important for them to make sure that they get access to healthcare. That is a reasonable expectation of people who are in need.
Yeah.
What government must do is make sure that you can that access is fair and reasonable, and what you want to do is to make sure that the overall system is generally open and fair to everybody, that you don't have funny rules and things that apply at point of service. Minimize those so that people can just walk in and get treatment. Compensation is something you sort out at a higher level.
You mentioned South Africa having accountability to SADC treaties and the like. So besides our country's constitution, what are South Africa's obligations on both the regional and international human rights laws, and who is monitoring whether or not we are fitting or sticking to these?
Well, the sort of the regional agreements don't really address this. The SADC arrangements are to do with a customs union. And South Africa essentially pays into that customs union. So the customs union deals with imports and tariffs, so that there's uniformity around all of the countries in the region. Otherwise, you're going to have all sorts of sort of risk transfers within the region, trying to take advantage of different tariff levels. So the customs union is an agreement within the region which allows for inter-country transfers of what is essentially tax revenues. Mm-hmm. And that is potentially an indication of the kind of agreement that's required when you're dealing with people crossing borders to use healthcare services. But it's important to note that provincial hospitals have not implemented billing systems, etc., to be able to say, well, this was a Zimbabwean citizen. Here's the bill. Here's how much they costed. They don't do that. And so you actually don't have anything to take to Zimbabwe to say, pay for this patient. Now, what you want to do is to make sure that there is a system in place that allows for an invoice to be developed for everybody using this service. People have a right to use these services for free. Mm-hmm. So it's zeroed as a charge for the individual using the service. But that account allows you to go to somebody else who might be a payer, whether it's a medical scheme, a social insurance fund, or a foreign country, and to say, here's the invoice for this particular individual. Now, these systems have to be negotiated and set up, and it's to allow for these transfers to occur. But what you want to do is to manage the risk to South Africa of cross-border flows of people to use healthcare services, which is inevitable. It's a risk you have to manage. You're not going to stop it. You have to manage it. And the problem has been that nobody's managed it.
What role can law enforcement play in this, and can they intervene to ensure proper conduct within our health systems?
Well, law enforcement should be protecting people from being abused at point of service. So if there is somebody who's barring somebody from accessing a healthcare service because for any reason, law enforcement should be turned on those people. Where you've got foreign nationals using public healthcare services, the way in which you manage that isn't through law enforcement. It's through setting up a proper system to ensure that there is a payment in respect of those individuals that doesn't come from that individual. So foreign countries can pay, and they should pay. But South Africa has a responsibility to set up that regime and also to negotiate it into existence. But the perpetual gripe that there are foreign patients burdening the public healthcare system is an indication of public system failure. They need to set up the systems so that isn't a burden on the South African healthcare system. But to sit and do nothing is wrong. So law enforcement is not the route to protect the health system. That law enforcement is there to protect the patients from inappropriate behavior and misconduct of other members of society or unfair discrimination. But the overall arrangement to protect the integrity of the public healthcare system is the responsibility of the government. And unfortunately, they have been AWOL for a considerable period of time in sorting out this problem.
How should we continue then the monitoring roles of bodies such as the South African Human Rights Commission and other NGOs or civil society groups in terms of checking what's going on? And are they even listened to when they raise the alarm or raise concerns, these monitoring bodies? What should we do to continue from here on out?
Well, I think that what the Human Rights Commission has done is really important. So although it doesn't have any direct explicit effect, it makes the issue known, and it doesn't give moral support to inappropriate behavior. It doesn't provide any moral backing to the people who are attacking vulnerable individuals. That's important. I think that sentiment in itself is very important. I think the fact that we're discussing this matter now shows how important the Human Rights Commission's public statements are. And it's right, they are part of overseeing the South African Constitution. Now, the responsibility for giving effect to the South African Constitution, a large part of that obligation falls on government. And what they're actually making very clear is there's a deficit here. Government is actually not dealing with this matter in a responsible manner. But there is no way in which you can provide any moral backing to the attacking of vulnerable people or shifting the burden onto vulnerable people to deal with a problem that government itself is organized and has a legitimate role in resolving in a fair and reasonable manner consistent with the Constitution and the constitutional principles.
Professor Fandenha, thank you so much again for your time, and we appreciate it.
No, my pleasure.
Professor Alex Fandenha is chair in the field of Social Security Systems Administration and Management Studies, unpacking these concerns raised by the South African Human Rights Commission, or the SAHRC, that there are reports that some healthcare facilities are denying health treatment to individuals on the basis of nationality or documentation status. We're going to get news headlines in just a bit, but it is Thursday,